All right, so this video we're going to do a quick introduction of the issue of euthanasia and physician-assisted suicide. So mostly what we're going to talk about in this video are just some concepts that are applicable to this issue, and then go over just a couple of general approaches in arguing for its permissibility. So let's start with some background. Just some definitions here. So euthanasia generally refers to the direct or indirect bringing about of someone's death for that person's own sake. And there, as we'll see, there's different kinds of euthanasia, and it is distinct from physician-assisted suicide. Voluntary euthanasia is performed on a person with their permission, and in bioethics, voluntary euthanasia is usually what they mean by euthanasia. Another important concept here is an advance directive. So this is just a legal document that tells physicians what to do to you if you are incompetent. Say you are in a vegetative state or in a coma or something like that. And this is a document that you would work up prior to that happening. So for example, in the advance directive, you may say, in the event that I'm in a coma for more than a week, just pull the plug. And that would be an example of passive euthanasia. Non-voluntary euthanasia, which is distinct from involuntary euthanasia, is performed on a person who is not competent to decide the issue and has left no instructions on what to do in the event that they become incompetent, say through an advance directive. Now, with non-voluntary euthanasia, usually that happens when someone is in a coma, and that's basically the same thing as pulling the plug. So that's distinct from involuntary euthanasia, which refers to euthanasia performed on somebody against their will, against their wishes. And usually in bioethics, people don't really talk about involuntary euthanasia because it's obviously wrong. I mean, maybe it's wrong, so we don't really talk about it much. So when we talk about euthanasia, we're usually referring to voluntary euthanasia. Now, a further distinction can be made between active euthanasia and passive euthanasia, and I've talked about this a little bit. Active euthanasia is euthanasia that's performed by taking a direct action to cause somebody's death. So it involves direct killing, which is more controversial than passive euthanasia, which is euthanasia performed by withholding or withdrawing necessary means of sustaining life. So in other words, pulling the plug. And so some say there is not a moral difference between these two. Others say that there is a moral difference between these two, and that moral difference is sort of indexed to whether it involves direct or indirect killing. And so if you believe that directly killing is worse than indirect killing or letting die, then you're going to think that active euthanasia is at least wronger or more bad than passive euthanasia. And finally, physician-assisted suicide is distinct from euthanasia. This is the killing of the person by that person's own hand with the help of a physician. So currently in the United States, active euthanasia is not legal anywhere, but physician-assisted suicide is legal in certain states, like Oregon, for example, it's legal there. And part of the reason is because generally physician-assisted suicide is less controversial than active euthanasia because it does not involve the physician or the healthcare professional killing the patient. The patient kills themselves, usually by taking pills that are prescribed to them by the physician. So it's controversial whether there's a moral difference between physician-assisted suicide and active euthanasia. If there is, then that moral difference is going to depend on whether there's something less bad about a person killing themselves with the aid of the physician than the physician killing the patient directly. Now, you might say, well, why not just have physician-assisted suicide be morally permissible or legal? Why would we need active euthanasia? And one reason is because that some people argue is that, well, active euthanasia, voluntary of course, should be legal because there are some cases in which a patient wants to die, and let's say it's justified for them to kill themselves because of their enduring pain or whatever. But they're unable to take the medication themselves to end their own life. And so in that case, the only way to get that done is through voluntary active euthanasia. So that's one argument in favor of active voluntary euthanasia. So just a quick overview of some moral arguments and whether or not voluntary active euthanasia is permissible or physician-assisted suicide is permissible. I would say that most arguments in favor of voluntary active euthanasia can also be applied to physician-assisted suicide. So there's two general approaches that we can take toward this issue, as with many issues. And one is kind of a Kantian approach, which emphasizes the value of personal autonomy, and the other is a more consequentialist approach, which emphasizes harm prevention or helping people. So the first approach, we might say, is taking a right of self-determination seriously, the patient's autonomy seriously. This approach basically says physician-assisted suicide is permissible because a patient has the right to determine whether or not their own life is worth living or not. So this approach values or emphasizes the value of liberty, the value of autonomy, and to say, people they have a right to do what they want, to their own bodies. Maybe there's some conditions there, that would be another conversation, but this approach basically says a patient has the right to determine whether or not they should live. The second approach may look at the principle of beneficence, which says that the healthcare professional should aid the patient, help the patient, and it also can appeal to the principle of non-maleficence, which says that the healthcare professional should or has an obligation to reduce harm. That's kind of the whole point of healthcare, both of those principles. And both of those principles are consequentialist in that we're looking at producing good consequences. We have an obligation as healthcare professionals to produce good consequences. And so, in some circumstances, the best thing for the patient to reduce their harm and perhaps to help them is to actually end their life. So in cases, for example, in which a patient is, so the argument goes, is under extreme agony and enduring agony, where the only way to end that agony is through the ending of the patient's life, then under those conditions, physician-assisted suicide and perhaps euthanasia would be justified. So that would be a consequentialist approach to this issue. So the last thing I want to talk about, just real quick, is a related issue, which is killing versus letting die. Many would argue, or many believe, that killing is worse than letting die. And so in some cases, letting die is permissible, but killing is impermissible. And so this raises lots of questions. So what's the difference between killing and letting die? Do any of these differences make a moral difference? So one difference could be intention. When it comes to intention, if you're killing, then that obviously involves intending the person's death, at least in many cases. Whereas letting die may not involve intentionally killing or wanting the person to die, something like that. So perhaps the moral difference could be could hinge on the intention that's involved. Perhaps there could be other explanations of the moral difference between the two, if there is a moral difference. Maybe there's not, and maybe it depends on the situation. In any case, the way this is related to euthanasia and physician-assisted suicide is that, again, with euthanasia, that involves at least active euthanasia. That involves directly killing the patient, and maybe that's worse than letting the patient die through passive euthanasia. And so this shows how, for many, active euthanasia is more controversial than passive euthanasia. And that can also, this distinction could also apply to the purported moral difference between active voluntary euthanasia and physician-assisted suicide. Active voluntary euthanasia involves directly killing, whereas physician-assisted suicide involves letting the patient kill themselves. And so if those are different morally, that could be an explanation where physician-assisted suicide is less controversial because it involves letting die, and that's not as bad as actively killing, which is involved with euthanasia. Okay, so just to kind of sum up, the purpose of this video was to introduce some of the concepts involved with the morality of euthanasia. We looked at the difference between active and passive euthanasia, voluntary and non-voluntary euthanasia, and involuntary euthanasia. We looked at what an advance directive is, and by the way, it's good to have one. If you don't have one already, most people don't, so it is a good idea to have an advance directive. And then we looked at some consequentialist approaches to evaluating the morality of euthanasia, and we looked at some non-consequentialist approaches, specifically the ones that highlight the value of autonomy when it comes to euthanasia.